Section 16II, it's our norepinephrine, also known as Levophed. Some of you may have heard the phrase Levophed, leave them dead. Get that out of your head. Levophed works very well. It's a really good medication to know how to use if it's used properly. The class is a vasoconstrictor. Stimulates alpha receptors in the peripheral vasculature, producing vasoconstriction-related increase in systemic blood pressure. Concurrent beta receptor stimulation may produce increases in heart rate and mild bronchodilation. The norepinephrine is a weaker beta stimulator than dopamine. Your indications essentially is going to be hypotension, but your congestive heart failure, post-cardiac arrest treatment, acute coronary syndrome, sepsis, dialysis-related issues. For all listed situation, indication again is hypotension. Adult is systolic less than 100 due to cardiogenic, septic, or neurogenic shock, either refractory or intravascular fluid boluses, or in which intravascular fluid bolusing is contraindicated. So essentially what that's saying is if their blood pressure is low and, for example, they have congestive heart failure and they're full of fluids, so we can't just continue to load them with fluid, we would go to this norepinephrine. Contraindications, obviously, it's going to be hypertension. Norepinephrine is going to raise their blood pressure, so if they have high blood pressure, we don't want to raise it anymore, and it will raise it substantially. Onset of action within 5 minutes after IV-IO infusion is initiated. Rapid metabolism requiring ongoing IV-IO infusion to maintain clinical effects. Side effects, few, though at higher doses, symptoms may include headache, palpitations, tachycardia, chest pain, and eventual hypertension. Bradycardia can result from an increase in blood pressure. The big thing, and I can tell you from experience, when you do give norepinephrine, just make sure you're continually monitoring your patient. That made me sound really bad. Not that I didn't continually monitor my patient, but make sure you're taking a blood pressure pretty consistently. It will raise their blood pressure pretty quickly, and you want to make sure you're not going to send their blood pressure through the roof. Your dosage, you're going to start at 2 to 4 micrograms per minute. There's this dosage chart down here at the bottom. And you're going to titrate it until you obtain that blood pressure, the systolic blood pressure of 100. Your maximum infusion rate is going to be 12 micrograms per minute. So I would know that. You start at 2 to 4 micrograms per minute, and then we'll go over how it's packaged so you don't get confused on that. We're going to use a 60 drop set on this, and then again, here's the chart. On the top, it says micrograms per minute, so it says 2. So your 2 would be 15 drops a minute. Your max would be 12, which would mean that it's 90 drops a minute, and it just goes up in between there. So 322, 4 micrograms per minute would be 30, and so on and so forth. But our initial dose is going to be 2 to 4. And scroll down here. Again, it talks about our dosages, and the only one you need to really pay attention to is the very bottom for hypotension, shock, refractory to fluids, or fluids contraindicated. It's going to be online medical control order only, and that is for your dialysis sepsis. So here we go. How it's supplied, it's 4 milligrams per 4 milliliter ampule or vial. So use only 2 milliliters in a 250 milliliter bag of D5W. Not normal saline. So you're going to put 2 milliliters of your norepinephrine in your 250 milliliter bag of D5W. It's an 8 microgram per milliliter concentration. Always check concentration and dose per container at the time of patient medication administration. Some special comments. In the setting of tachydysrhythmia-induced cardiogenic shock, treat per protocol 5G tachycardia unstable. Ensure aggressive fluid resuscitation is accomplished unless contraindicated prior to norepinephrine use. Norepinephrine should be given into a large patient vein. The vein of choice for EMS use is the AC, which left to right doesn't matter, as this will decrease the risk of the overlying skin necrosis. Do not administer norepinephrine through an IV in the hand or the leg. These veins are more likely to be affected by vaso-occlusive diseases. and more prone to ischemic complications. Administration through IO in the proximal tibia or humeral head is permitted. If local extravasation occurs, notify the receiving physician of the following FDA advisement of antidote to extravasation ischemia. To prevent sloughing necrosis in peripheral ischemic areas, promptly use syringe with fine hypodermic needle to liberally infiltrate area with 10 to 15 milliliter saline solution containing 5 to 10 milligrams. And let's see, the bottom, safety in pregnancy is not firmly established, though when clinically indicated, the benefits outweigh the risk. Safety in pediatrics not firmly established, and online medical controls to be consulted prior to pediatric use. Avoid mixing in normal saline, as normal saline promotes the loss of potency through oxidation of norepinephrine. That's why we use D5W. And then just kind of hitting that part up top again, you'll hear some people say that it's not safe in pregnant females, but again, it outweighs the risks. The pros are better than the cons. If their blood pressure is low and we can't get their pressure up through fluids for whatever reason, then obviously we have to get their blood pressure up or they'll eventually go into cardiac arrest. So just keep that in mind. We'll just hit this one more time. It's supplied 4 milligrams per 4 milliliter ampular vial. Use only 2 milliliters in a 250 milliliter bag of D5W. I'm saying that multiple times because you need to know it. And then up here, your dosage, you're going to start at 2 to 4 micrograms per minute. So just don't get those confused. You're going to start at 2 to 4 micrograms per minute, but it's 4 milligrams per 4 milliliters ampular vial, and you're only going to use 2 milliliters in a 250 milliliter bag of D5W. Any questions on that, feel free to reach out. Me or Jake or any of the EMS staff will be happy to help you. It's a good medication to know and to use. Don't let it freak you out. Once you start to figure it out, it's very easy to give.